Hello, good people. How are you today? I hope that today is finding you well, and I hope that you are in very good health. So, today is June 12th, which makes it the 12th day of Uterine Cancer Awareness Month. And as I always say, me being a uterine health um, advocate, I think it's important that I align myself with initiatives and awarenesses and things of that nature so that I can provide you with information regarding uterine health and, of course, things about uterine cancer and all things regarding the uterus, the womb, so to speak. I also want to say that I really do appreciate you engaging with the channel, from your viewerships to your subscription to liking, commenting, asking questions, whatever it may be. I really, really do appreciate it. So I say thank you so much. So that's my way of saying go ahead and subscribe, like, comment, share, all that stuff. That's my way of saying that. Okay. So, per usual, my disclaimer is I am not a medical doctor, and the full description is in my the description area. I'm about to say in my link, but I'm like, okay. So I do have one special note today on this June 12th day. Today is my birthday, and I'm very happy to be here. And celebrating another year on Earth. So I count it as a blessing, but I just thought I'd like to share that information with you because we know that as we get older and we're hearing so many different things happen in the world, we know that not everyone has the privilege, not everyone gets the grace, not everyone makes it to their next birthday. So I'm utterly, utterly grateful. So, in today's conversation on the 12th day of Uterine Cancer Awareness Month, I want to talk about the various types of gynecologists and what they do. And per usual, I just did a quick internet search to provide you with, high level information. If anything that I ever say resonates with you, hopefully this will encourage you and inspire you to dig a little deeper and do some more deep diving kind of research and things of that nature. But I'm not sure what caused me to look up how many different types of gynecologists there are, but I did. So let's get into it. So gynecologists, first of all, are gynecologists special in women's reproductive health. That's what they do, with most acting as generalists. So sometimes they will simply, I won't say simply because they spend a lot of years in school, they will solely, it's the word, be a gynecologist. However, after completing their core residency, many doctors undergo an additional fellowship, additional training to specialize in one or several board certified subspecialties, each focusing on areas that evolve around reproductive and pelvic care. So here are the main types of gynecological specialties. So they include what most of us have heard throughout our life, which is OBGYN, which is obstetrician. I can't even say it today, and gynecologist. And this is the most common type. They combine their general gynecology, which is the treatment of the reproductive system, with obstetrics, which is managing pregnancy, labor, and childbirth. So you might see a gynecologist just for regular, reproductive treatment, but you might see an OB-GYN if you are, for managing pregnancy, child labor, and things of that nature. So the second type I found was MFM, maternal fetal medicine specialist, and they are often called high risk pregnancy doctors. They manage complex pregnancies such as those complicated by chronic conditions like diabetes or severe hypertension. So you have those type of doctors. There's also I hope I'm getting these titles correct. There's also an REI, which is a reproductive endocrinologist. Sorry. They focus on hormonal functions related to the reproductive and infertility. They evaluate infertility and provide treatments like in IVF. in vitro fertilization and surgeries to restore facility. I cannot believe I'm having a tongue twister on this beautiful June 12th day. My goodness. So those are the doctors. When you do hear people are having challenges with fertility, they will go see a reproductive endocrinologist. And your endocrine system, just so you know, is the hormonal system, and that's what manages your hormones, especially when you hear about your estrogen and progesterone and things of that nature, and your adrenal glands. Those are things I'm learning about as well. And then you have your gynecologic oncologists. They specialize in diagnosing and treating cancers of the female reproductive system, including cervical cancer, ovarian cancer, uterine cancer, and vaginal cancers. They perform complex cancer surgeries and administer treatment like chemotherapy. That was one of the things that my doctor, when I first started going to her, and she said if your biopsy ever shows cancer cells, she would have to transfer me to an oncologist. That's when I thought to myself, there's a special oncologist just for females, to deal with this. When you don't, I've been very blessed. I haven't spent my life with doctors and hospitals, so I'm learning a lot, guys. And I'm very impressed, and I'm very happy to learn all this information, and that's why I share it with you, so that you can know it as well. And nothing there may be things I say that does not relate to you, but you might be in a conversation with someone and you might say, oh, why don't you try going to this type of doctor? Are you just going to a regular OBGYN? You might want to go to an oncologist. You might want to do this. So the next part is a urogynecologist, which is a gynecologist that specializes in female pelvic medicine and reconstructive surgery. They treat the pelvic floor disorders, which includes conditions like urinary or fecal inconsistencies and pelvic organ prolapse. These are things I've never even heard of, but we see they exist, and we see the need for them. And I know what made me think about this. I saw something on social media about urologists, and I thought, well, what does a urologist do? And then that dove me into that. Somebody said they were a urogynecologist. That's what made me think to myself, well, how many gynecologists are there? Types of gynecology are there? So that's what made me do that. So the next type of gynecologist is a complex family planning specialist. This particular doctor focuses on providing advanced contraceptive care, abortion care, particularly for patients with severe or complex underlying medical conditions. The next type of gynecologist is a pediatric and adolescent gynecologist. I never even knew that was an option for me to have, especially as an adolescent. But they focus on the reproductive health of children, teens, and young adults, managing both common and complex gynecological conditions early in life. I think that that's beautiful. I guess when your daughter, depending on what's going on in their lives, but this would be maybe like their first doctor that they could have. The next one and the last one is called MIGS, MIGS, and they are minimally invasive gynecological surgeons. They focus entirely on performing complex surgeries such as hysterectomies or removing fibroids using advanced techniques like laparoscopy and robotic surgeries to ensure faster recovery. So, but I do know too that gynecologists can do this as well. So they may have this as their specialist. As one of their specialties that they do. So those are just some of the, those are the ones that I was able to discover. So that So you have your obstetrician gynecologist, which is your OBGYN. You have your maternal fetal medicine specialist for like high risk pregnancies. You have your reproductive endocrinologist, which focuses on like IVF, to help women with fertilization. You have your gynecological oncologist, which specializes in cancer of the female reproductive system. You have your urogynecologist that mainly deals with the pelvic area, like so your pelvic floor and different things of that nature. You have your family complex planning specialist that provides advanced contraceptive care and abortion care. You have your pediatric and adolescent gynecologist, which really focus on the reproductive health of children, teens, and young adults. And you have your minimally invasive gynecologic surgeon, which focus entirely on performing complex surgeries such as hysterectomies and removing fibroids. So those are the type of doctors that I was able to find. And of course, you know me, I'm always going to have some article for references. So I have two of them today. The first article for reference, and this is just for you if you want to go a little deeper or see where I pulled some of my information from. The first one actually is Indeed, which is a job, which is where people go look for jobs, but they actually have an article, 7 types of gynecologists plus typical specializations. So they do have this out there, I guess, if people are wondering what field they may want to go into. So it does have a broad description of it. And I even think it has salary too. I'm not sure, but it may have there. And then the second one I have for you is from the American College of OB, OB and Gynecology, Specialties of OBGYN. Um, that's the name of the article, sorry, is Specialties of OBGYN. And it lists all of the different specialties of gynecology. So I thought that was pretty interesting. Sorry for the flumble of the words today, but I probably would do this over and I probably would get the same thing. So I like to talk to you like I'm talking to a friend. I like to talk to you as if you're right next to me. So I don't try to be perfect. I just try to be me because that's the only thing I can handle at this point. It's just being me. So I hope that this information was helpful, that if maybe need to see a different type of gynecologist, or you may need to share this information with someone else, or if you just wanted to dig in a little deeper. But I thought it was good to know the different types of doctors that are taking care of our uterine, our uterine health our female reproductive system. It's nice to know that we have several different options. So I hope this information was helpful to you. I hope that you have a great day. And until next time, you take care of yourself. Remember, you are important. If you have any discomfort, any pain, take the time to stop, make the appointment, go see the doctor. Okay? All right. Talk to you soon. Bye.